All right, so I've got another interesting case I wanted to just put together for you. This is actually, I think, a pretty good discussion and it might apply to you, so take a listen. This is a 56-year-old gentleman who presented to me a few weeks ago. His main complaint is he's got some back pain, but his main complaint is aching down his legs and numbness and tingling in his legs, really on the right side more than the left. He can't walk more than half a mile without starting to feel this heaviness in his legs. When I start to hear that, I start thinking about stenosis or claudication symptoms. Stenosis is just a medical term for tightening around a normal space. We got an MRI scan of his spine. I'm going to show that to you right now and walk you through that a little bit. So this is the side profile of the spine on the left. You can see there's some sort of waistline or bottleneck going on right here. He's got a little bit of degeneration down in this lower area of the spine at the 5-1 level, but something's going on here at L3-4. This is the top-down view on the right side, and if you've watched my How to Read Your MRI video, you'll be familiar with this. If you haven't watched it, take a peek at it. This is a pretty normal-looking spinal canal right here. This whitish triangular region, these little black dots are the nerve roots. That's the disc right there. When we have stenosis, we have narrowing of this space. So I'm going to move this cross-sectional line. You follow it. I'm going up to the L3-4 level here. And all of a sudden you see, wait, those little dots, they all converge, they come together, and they get kind of compressed into this little space here. Some big white thing right here, that's actually a cyst that's growing off of the joint, the facet complex on this is the right side. And he's got some significant arthritis growing off on the left side as well. So really something pathologic or problematic is happening with these joints. When I see that, my first concern is there's some slippage or micro instability or even gross instability present at that segment in the spine. So our next step was to get some dynamic x-rays, meaning flexion and extension x-rays. We want to see if there's actual motion or slippage occurring at that vertebrae. Here are the x-ray pictures. On the left is the extension, that means he's leaning back, and really this is the L3-4 level right up here. The posterior vertebral line looks like it's intact. If it's not, and I'm sure on another video I'll show you a slipped vertebrae, this is not slipping when he leans back, and over here on the right it's not slipping when he leans forward. This line is maintaining normal alignment, so that is a good thing. Okay, so back to the MRI. This patient's not developing any slippage. He's got a problem in the facet joints. He's got stenosis. My consideration for him was, well, you could either just do a synovial cyst resection versus do a fusion. A lot of people might consider doing a fusion with that much joint arthritis. I told the patient that there is a risk that down the road he could develop some instability because those joints are definitely pathologic and they're problematic. And if he continues to have arthritis grow or develop at that segment, it could result in some instability developing there. My recommendation for him was to proceed just with a laminectomy. In fact, I actually also recommended a motion sparing product. It's called the Coflex. This little metal device here goes in between the lamina, so the cyst is growing out from inside off of this joint. This is the facet joint right here. It's growing off of that joint. We would do a laminectomy, and a laminectomy means removing part of this bone on either side. When we're done, we can place this little Coflex device in between the spinous processes. And that's a helpful thing because it does provide some stability, and it helps keep this little channel where the nerves are leaving, it helps keep it open. So I like this device. I call it it's kind of like an insurance policy on your laminectomy. Not all insurance is covered, so that's a bit of a pain, but you can have it done. If your insurance denies it, you can pay for it out of pocket. That's not great, but if it's your health, it's your body, you might as well do the right thing. A caveat for this patient was there's a possibility, even if we fix everything, we get your legs feeling better, those facet joints, they are problematic and they can continue to cause you problems. They can develop instability down the road. There's a chance this patient might need a fusion down the road, and I warned him of that. I talked to him about it. But I think going in eyes wide open, having that conversation is pretty important. I like to avoid the fusion on the front end rather than overcalling the need for it and setting the patient up for kind of the domino coming back for more and more surgery, more and more fusion surgery, which is really what I want to try to avoid. I think that's the right approach. That's what I would want for me, and that's what I want for my patients and my family. If you have questions, if you have a spinal condition that's anywhere near what I'm talking about, I'm happy to review your films. I'm happy to see you in consultation. Please reach out to me, ask me a question. Let me know how I can help. Thanks so much. Have a great day.